Good evening. My name is David Goldbloom. I'm a psychiatrist in Toronto at the Centre for Addiction and Mental Health and a professor of psychiatry at the University of Toronto. And I'm here to ask you an important question about mental health in our country. What will it take? Let me start with a simpler question. How many of you know someone in your family, your circle of friends, your neighborhood, your school, your place of work who's experienced mental illness? Hands up. How many of you know someone in those same spheres who died by suicide? Hands up. Take a look around the room. Now, how many of you think the status quo around mental health in Canada is acceptable? What will it take? In 2007, as I waited to speak to a room much like this, a very friendly woman sat next to me, introduced herself, and asked me the most terrifying question I know. How do you like my new haircut? As I stammered, trying to think of a clever response, she explained that she had had breast cancer a year earlier, that her long hair had fallen out and had just regrown to a pixie-ish length. And I said to her, we just met 90 seconds ago, but you felt comfortable to tell me that you'd had breast cancer, surgery, radiation, and chemo. And I asked her if she would have been so candid if she had been depressed last year. And she said, absolutely not. And I know depression. My husband was hospitalized for depression. What will it take? In the last decade, the landscape has been shifting. With Bell Let's Talk, the Jack Project, and with the candor of individuals like Romeo Dallaire, Clara Hughes, and Margaret Trudeau, the conversation is opening up, but the shame and the secrecy persist. The obituary of a young person that says, died suddenly, and no disease charity is named, remains our newspaper code for suicide. And only rarely do we see the lost a courageous battle with depression or schizophrenia, the same way we do for cancer or other potentially fatal illnesses. What will it take? In Canada, very recent research by Calgary's distinguished psychiatrist and epidemiologist Scott Patton has compared depression in Canada in 2012 to 2002. There has been no change in the frequency of this illness in a decade, only greater awareness. But in 2012, 10% more of depressed Canadians had 6 or more visits with any health professional about their mental health, with a family doctor, a psychiatrist, psychologist, social worker, nurse, psychotherapist, or counselor. So that's good news, right? Except that it was only 40% of depressed Canadians in 2012 who received this kind of ongoing help. About 1/3 of these depressed Canadians in 2012 were receiving antidepressants, no real change from 2002. And the data are very different from the perception that everyone I know is on an antidepressant. Put them together, and the authors speculate that perhaps 50% of depressed Canadians are receiving potentially adequate care. How would you react to the good news that 50% of Canadians with cancer receive potentially adequate care? What will it take? In Ontario, a study of the burden of disease as measured by years lived with disability and years lost due to premature death showed that the burden of mental illnesses for Ontarians was 1.5 times greater than all cancers combined and 7 times greater than all infectious diseases combined. How is that reflected in the way we allocate resources to help affected individuals and their family? Across this country, about 6 to 7% of all health dollars spent go to mental health. In other countries like the UK and New Zealand, the number is more like 11 to 13%. And some of that goes to much needed innovation in how we deliver mental health services. Simply increasing the number of psychiatrists is simply not the answer. The Mental Health Commission of Canada, in its 2012 National Mental Health Strategy, called on governments at the federal, provincial, and territorial level to raise spending on mental health from 7% to 9% over 10 years. What will it take? In the UK, since 2008, A program called Improving Access to Psychological Therapies has, through the public purse, provided citizens with evidence-based psychotherapy that actually matches need to expertise and intensity. Over 2 million people have been treated outside the traditional mental health system through this program. In Australia, a family doctor can refer patients for publicly funded cognitive behavioral therapy from psychologists, recognizing the roles of a variety of providers in healthcare. Internet-based psychotherapies overcome barriers of geography and cost in a very different way, but one that's highly relevant to our massive country. What will it take? So here are some facts. 1 in 5 Canadians every year experiences some form of mental illness, and it's not the same 1 in 5 Canadians each year. It's like when they tell you in Manhattan that a person is hit by a car every 11 seconds, you shouldn't think that guy should get out of town. It's about a vulnerability that we all share. Every day in Canada, 500,000 people are away from their jobs due to mental illness. It's the leading cause of disability in the Canadian private and public sectors, and it costs the Canadian economy more than $50 billion a year. Some Canadians are apparently heated up about a planned federal deficit. Where is the heat about this ongoing deficit due to mental illness, not to mention the unmeasurable cost to the dignity, functioning, and quality of life of people with mental health problems and illnesses and their families? What will it take? Well, in my view, it will take more than government. It will take all of us being galvanized to speak openly to our families, our friends, and our colleagues about a common human experience, to demand better services and supports with a broad view of the determinants of health, as well as the necessary research to improve understanding and treatment. There are many examples for Canada to follow. What will it take for Canada to lead? Thank you.